Coming up on Harvard T.H This Week in Health, meet the graduates.
HIV is a very unique disease. I think it's both an intellectual challenge, but also a very important global health program that we desperately need to fight.
This week we share the first of two profiles of those who are wrapping up their PhD programs this year. We'll meet Pedro Lamothe-Molina, an aspiring physician scientist who has spent the last 5 years exploring a critical question about HIV. Hello and welcome to Harvard T.H This Week in Health. It's Thursday, May 18th, 2017. I'm Amy Montemuro.
And I'm Noah Levitt. Commencement here is just a week away. And to mark the occasion, we'll be sharing profiles of two of our students who are wrapping up PhDs this year.
First is Pedro Lamothe-Molina, who is graduating with his PhD in Biological Sciences and Public Health. He's an aspiring physician scientist, an HIV researcher, and an accomplished triathlete.
You'll hear about all of that as I share part of my conversation with him, and at times you'll hear me and Amy share a little more context about Pedro and his work. And to get us started and to give you a sense of just how accomplished he is, consider that Pedro applied to medical school when he was just 12 years old. I want to start off by asking you about this great story. You applied to medical school when you were 12, which I think is a really kind of fun story. What inspired you to apply at the age of 12, and then what actually happened when you applied?
Most of these things weren't very planned. They just, happened. I grew up in a family where there were several physicians in the family, so that's something I've always looked up to. So I wanted to be a physician from very early on. And I was interested in science, and especially biological sciences, and medicine was the bigger plans for my career very early on. I had the opportunity to advance faster during the first years of school, so I ended up having finished high school, and in Mexico, as in many other countries, you can apply to medical school as an undergraduate. So instead of being a 4-year program as a graduate program, it's a 6-year program, but it starts right after high school. So when I finished high school, I had to decide where and what to apply to, and that was, as I said, not very planned. So I was just there, and I wanted to apply to medicine. So I did apply. I had actually was a phone interview with the head of admissions from the university, and he said that he had reservations whether I would do good or not, being at that young age. He said that I was academically qualified enough to be a medical student, but he said that maybe emotionally would be difficult for me to go along the path of medicine at that age.
And so you mentioned being in a family of doctors. And you eventually did end up going to medical school. So was this something that you kind of always felt drawn to, working in medicine, working in public health, doing something kind of in the health field?
Yes. So I think it was a little bit of two things. I've always enjoyed science and knowing things, but also wanted to do something that has an impact and helps people.
Pedro did eventually graduate from the Mexican School of Medicine at the Universidad La Salle, but first he actually made a detour into engineering.
At the slightly older age of 17, Pedro graduated from the Monterrey Institute of Technology and Higher Education. While there, he focused on engineering projects related to biology. One invention was an electronic device that could measure and record patients' vital signs.
While Pedro didn't pursue engineering as a career, he did tell me that what he learned in school has been valuable as a public health researcher. He says that engineering has helped him learning how to design complex projects.
An example of a complex project, Pedro's dissertation, which looked at a type of white blood cell called a CD8 T cell. It's particularly good at fighting infections, especially viruses, in people with HIV. Pedro helped identify a unique mechanism through which T cells recognize HIV-infected cells and showed that this process is linked with certain people's ability to control the virus.
That research is helping to shed light on a lingering question among HIV researchers. Why do some people with HIV never get sick? I asked Pedro about that, but first he explained why he was drawn to HIV research in the first place.
Early on in medicine, I was fascinated by the coevolution race between pathogens and the immune system. I just found that very, very interesting. And HIV is a unique disease, a very unique disease. I think it's a very new disease. It's not been in the humans for very long, but it has grown a lot, and it's a very, very important global health problem. We know a lot about the disease. If you read any textbook of medicine or biology, you see there's a lot that we know about the disease and the virus itself, but it's just not enough to be able to win against that particular virus. So I think it's both an intellectual challenge, but also a very important global health program that we desperately need to fight.
And so I know one of the specific things you touched on a second ago is this immune response, and kind of, I guess, specifically this idea that there are people who can get HIV, but they may not necessarily become sick. Is that something that's relatively common, or what do we kind of know about that?
No, that's a great question. So everybody responds differently to the virus infection. Some people respond better and have a stronger immune response, more robust immune response, and they can control the virus for longer. So when somebody gets infected, sometimes it takes a couple of years or a few years before they develop clinical AIDS. And some people develop clinical symptoms much faster than others. And there are people who have been infected for very long periods of time, and they have been able to suppress the virus long term and be able to prevent those clinical symptoms. So there are a few people between 1 in 100 to 1 in 300 that are able to suppress almost completely the viral replication below the levels of detection by most of the assays that we have in the clinic, and they've been able to control the virus for long. So we have a very interesting large cohort of those individuals that my advisor Bruce Walker kind of got along the years, and we've been trying to understand what is particular about those individuals and the immune responses that they mount against the virus, and trying to understand what is an effective immune response, what is an immune response that is effective looks like, and if there's something that we can use to replicate this as a potential therapeutic.
So in a sense, kind of what you're looking at is if you can take lessons from those people who naturally have an immune response to HIV, and that can be used in people who don't, almost as a treatment method?
Yeah, exactly. I think that's the ultimate goal. I think there are many steps that have to be gone from one side to the other, but that's the ultimate goal. I think it's first trying to understand what an effective immune response looks like, and see if there are any things that we can use that to build therapeutics further down the line.
So I think what's interesting is that you kind of you're working in kind of on the research side, which, as you mentioned, a lot of steps can be kind of a long process, but also kind of on the patient, the medical side. So I guess how important is it for you to kind of have exposure to both sides, the research side, but also kind of working with patients one-on-one?
No, I think it's great. It gives you a broad perspective, and I think it gives you a broad but also a clear perspective. When you're in the lab and trying to design things, you know what you have a better idea of what can be applicable and what would work in a patient if that were to succeed. And the other way as well, if you are in the clinic and see some interesting cases or interesting findings, then you can have ideas of what to do or what to study in the lab.
And so you mentioned working with Bruce Walker. When you were kind of looking at schools of public health, was there something specific that drew you here? Did you know you specifically wanted to work with him? What kind of brought you up to Boston?
So one of the things that was very appealing was this particular program that I applied to and ended up doing my PhD in, which is the biological science in public health. So I wanted to apply to a program, and I wanted to work in something that it was a basic science, trying to understand the basic mechanisms, but in something that was not far away from having an application. And I think so that's what drew me to this particular program. So I think that's really unique and great. Once I was in a program, I was interested in immunology and especially HIV immunology. And Bruce Walker is one of the leading scientists in T-cell immunology against HIV, and he has been for a number of years. So and being himself a physician and a clinician, I think it was a good fit for me because I wanted to work in basic science, but something that had potential application.
So I wanted to ask about that. You talk about this idea of being a physician and a clinician. For people kind of listening who might not be familiar with that, I mean, what does that really mean when you're kind of a physician scientist?
It depends. There are people who work more, work in the clinic, see patients, and take care of patients, and they do some clinical research with those patients and try to understand how things work. And some others do more basic science, where they're trying to understand the cellular or molecular mechanisms of certain diseases. And I think that's the particular site of a physician scientist, where you provide care to patients, but you use the knowledge you acquire from taking care of patients to get ideas to do research and do research projects in the lab. And the other way around, if every research project that you try to set up in the lab has the idea of a potential application that you can carry back into the clinic.
So when Pedro isn't in the lab or the clinic, he relaxes by competing in triathlons and running marathons.
He's completed about 20 triathlons, several of which have been Ironman length.
So in case you're not familiar, athletes in those grueling races swim 2.4 miles, bike 112 miles, and then run a marathon. I asked Pedro about finding the time to compete in these races and how he first got started in the sport. You're kind of focused on research, I'm guessing on data. How does that affect your triathlon training? Are you like a data geek and you're always analyzing yourself?
Yeah, a little bit.
And so how do you balance triathlon training with all like the work you're doing in the lab? Is that a difficult challenge for you?
Yeah, it's really hard. There are times where I don't have time to train at all, and there are blocks of training where I'm doing a lot of training, try to do it when things in their lab are not as busy. But yeah, it's hard. It's not easy to do both things for sure.
Are there moments in a triathlon where you're just regretting the decision entirely to do a triathlon?
Oh yeah, every time. Every time. There's always a point in a particular race where you're not feeling great and you're questioning, why am I doing this? But eventually you finish, and then it's like, oh, this is why I was doing it. So
you mentioned before the interview that you started off as a runner. So what inspired you to pursue triathlons? Was it just kind of the next natural step? It was an interesting challenge?
It was actually almost 11 years ago. It was my birthday in March, and I had my uncle. He is a very well-established triathlete, and he had done more than 10 marathons and half Ironman, and he was training for a full Ironman then, and I started doing a couple of 5K races and 10K races, and it was during my birthday. He said, like, oh, there's a triathlon in May, why don't you sign up for that? It's like, well, I don't own a proper bike. I have a mountain bike that has been in the basement for 5 years and I haven't used it, and I don't know how to swim. And so like, oh, you just do a sprint, it's fine, you'll do fine. So I actually went to my local gym in Mexico and kind of like got some lessons from a swimming instructor and read a couple of books about swimming technique and watch YouTube videos of how to properly swim. And then I took my bike out of the basement. It was a mountain bike, so I just did that triathlon, which is a sprint triathlon, and I just fell in love with the sport. And I said, like, well, this is the last sport I'll ever do, and this is the sport I want to do until I'm 80 years old. And a funny story, the event was actually where I met my wife.
So is she a triathlete as well?
She is, yes.
So you basically taught yourself how to swim?
Well,
from YouTube?
Yeah, I got a couple of lessons from an instructor. He was just telling me, like, oh, do this or do that. And then I had a friend from medical school in Mexico who was a really great swimmer. And then we went together to training, and he taught me a lot about that technique and got considerably better with his help.
And that was my interview with Pedro Lamothe-Molina. And as you heard him talk, you can really tell that family is incredibly important to him, both when it comes to triathlons and also his career in public health and medicine.
And as we talked about in the beginning, he does come from a family of doctors and scientists. Pedro said that his father not only came up to Boston to attend his dissertation defense, but served as a strong support system throughout the writing process, offering suggestions and edits along the way.
After graduation, Pedro will head down to Atlanta and Emory University, where he'll begin his medical residency. He's still unsure of his long-term plans, but he'll be doing his residency in internal medicine.
And as we mentioned at the beginning of the episode, this is the first of 2 profiles of our students we'll be sharing as we approach commencement. Next week, you'll hear the story of Dipali Ravel, who has been working to shed light on the biology behind the malaria parasite while also serving as an advocate for the importance of science education.
That's all for this week's episode. A reminder that you can always find us on iTunes, Stitcher, and SoundCloud. And if you are someone who listens on iTunes or Stitcher, we'd love it if you could take a few minutes and leave a quick review of the podcast. Those reviews will help more people find us.